Hi friends, in this particular final section of the Train Your Brain series with respect to microbiology, we're going to be talking about the first component, that is going to be parasitology, and the important buzzwords with regards to the questions that they put up in the exam would be as follows. Talking about the child who is going to be having the presence of a perianal itching, especially at night. That's the first important hint that they may give you in the exam. The second thing that they can make a mention of is the presence of scotch tape test, which shows you presence of eggs. Of course, a child having this kind of a perianal itching at night, and a scotch tape test is what is going to be immediately alerting you to the presence of enterobius vermicularis infection. This is also given the other important name of pinworm infection. This is the other important thing that you need to remember over here with regards to the image based questions, that they will ask you about the eggs of enterobius vermicularis as an important question for the exam. The next one talks about the presence of a child who's going to be having the presence of a growth retardation. He could be having the presence of an abdominal discomfort. Usually there is a presence of eosinophilia, and in the stool examination there can be a presence of large and thick white worms. Why does that take place is because this particular worm infestation is responsible for causing the development of retardation in a child, and the reason is because of the development of what is given the name of a giant roundworm infection, that is because of Ascaris lumbricoides. Now that's an example of a gross image that you see of the thick white worm in the exam, and this is a very classical egg of the Ascaris lumbricoides which is being asked in the exam. Make sure you're aware about this particular fact, that you're having the presence of this kind of a thick shell over here, which helps you to identify this particular worm infestation. This is never ever to be confused with another question in the exam which talks about a child who's going to be walking barefoot, and this child is going to be having a development of an iron deficiency anemia. So typically there is going to be a development of a microcytic hypochromic anemia, and the child is again going to be having the presence of an eosinophilia. That's because of the presence of an infection caused by either of the organisms that is given the name of hookworm infestation. अब hookworm infestation में हमारे पास दो examples आते हैं. पहला होता है Ankylosperma duodenale, and the second one that we talk about is Nicator americanus. Now that's an example of an image that they typically give in the exam. So make sure that you are not mistaking this kind of an example of an image of egg of Ascaris lumbricoides image with Ankylosperma duodenale. So in case of Ascaris, this was the example of the egg. That is how it looked like. I'm just showing it again, and make sure that you are having a look at this particular hookworm egg very carefully, because that is what they love to ask you as an image based question. The next one that we talk about over here is going to be a traveler who's going to be having the presence of a history of foul smelling, greasy, bulky diarrhea and bloating. Why is that going to take place? Because this is what is suggestive of a history of malabsorption. Typically, the infection is going to be seen in an individual because of the history of consumption of drinking stream water or contaminated water, and that water is going to be having the presence of the trophozoites. Now, these trophozoites are going to be having the presence of a face-like appearance, which is what is going to be causing the trouble over here. Of course, you know about this particular organism. What we are talking about over here is a grand old man of the intestine. We are talking about over here Giardia lamblia. Remember the fact with regards to Giardia, that's an example of a question that they'll very commonly ask you in the exam. That's in fact an example of a very standard NEET PG question. What was given as an INICET example of an image was this particular one. The low power magnification showed you the presence of these coma-like organisms over here, and the high power image showed you the presence of organism like this. Of course, you know the fact that with regards to Giardia lamblia, we are going to be having the presence of what is going to be given the name of a leaf-like image, and we are going to be having the presence of a falling leaf motility. And the best way for treatment of this kind of an infection is a pharmacology question. You do it with the help of a drug that is given the name of metronidazole, right? Talking about the next one, which is going to be talking about a patient who's going to be having a history of development of a bloody diarrhea. The patient is going to be having a complication which is going to be liver abscess, which is going to be having the presence of an anchovy-sauce, and along with the involvement of the liver, the patients are going to be having the presence of a right upper quadrant pain. If we are talking about the involvement of the intestine, it is a large intestine or the colon which is going to be getting affected in the patients, and that would be having the presence of the flask-shaped ulcers. So both these images have been asked in the exam. Of course, you are already familiar with the diagnosis as amoebiasis. Entamoeba histolytica is the organism that we are talking about over here. That's an example of the anchovy-sauce. This is an example of a flask-shaped ulcer that we are talking about in the colon of these patients. And of course, when we are talking about this kind of an organism, it is best treated with the help of which particular drug? The answer is again the drug that is given the name of metronidazole. Having said that, we are talking about an example of a patient who is going to be having a history of some kind of a tick exposure, which is then going to be followed by development of fever, hemolytic anemia and fatigue. Now, there is a possibility. Examiners are typically kind to you when they talk about this presence of fever and hemolytic anemia. They will make a mention of the fact that blood smear had the presence of Maltese cross. Mark this word, Maltese cross. But where is it present is again equally important, RBCs. So patient having a tick exposure, having the presence of multi-sclerosis in the RBC is very much suggestive of development of babesia microti or babesiosis, and that's an example of a very, very fundamentally important image that they put up to you in the exam. Please do remember the fact, if I'm talking about the multi-sclerosis, that can also be seen sometimes in the urine of a patient who is likely to be suffering from two conditions. Multi-sclerosis in the urine is a feature of a patient suffering from either nephrotic syndrome, or we would see it in a patient suffering from a condition that is given the name of Fabry's disease. Now I hope you remember the fact. What is the enzyme deficiency in Fabry's disease? Yes, you're right, that is caused because of a deficiency of an enzyme called as alpha galactosidase, right? So make sure that the presence of multi-sclerosis in the RBC is not based on the exam, because that is going to be a feature of babesiosis. Next one that I have talked about is specifically going to be a pregnant lady who is going to be having a proximity to cats, or there is an exposure to cat feces, or there is a consumption of undercooked meat. Now, because of which the fetus is going to be having a development of intracranial calcification, there can be a presence of hydrocephalus and there can be a presence of chorioretinitis. Now, whenever we're going to be talking about cat as an organism causing these kind of manifestations, so C for cat, C for remember the calcification, C for chorioretinitis, and C for cephalus, that means there is going to be hydrocephalus, more pressure, intracranial pressure, that's how we remember it. This is what is going to be having the presence of an infection caused by Toxoplasma gondii. Very commonly what they ask in the exam is, this would be an example of a congenital toxoplasmosis. How exactly do you make a diagnosis of a toxoplasma infection? That is done with the help of a test, the Sabin-Feldman dye test. Very, very commonly tested on the exams. They specifically ask you about the certain specific example of drugs which can be given for the treatment of toxoplasma infection, out of which one particular drug is what is being asked specifically in this condition, that is spiramycin. So just remember those keywords and the importance of knowing about the drug as well as the diagnosis of this kind of a condition. Talking about the next one, we talk about a patient who's going to be having a history of consumption of water which has been contaminated with copepods, and then it makes a mention of this particular feature, painful scale ulcer in the lower limb specifically, and there is a presence of an emerging long white worm. Long white worm, not in the stool, my friends, but it is coming from the lower limb ulcer, and that's an example of a painful ulcer, specifically in an area which is going to be in proximity with the contaminated water. So that is what we are talking about over here. We are talking about something called as guinea worm disease, which most of you are familiar with from your knowledge of community medicine, has now been eradicated from most part of the world, but still sometimes they would love to ask a question on this. And the technical name for the guinea worm infection over here is Dracunculus medinensis, right? So that is what you just need to be familiar with over here. Having said that, we talk about a swimmer who is going to be having a history of swimming in the freshwater region. Then he's going to be having the presence of a rash and fever, and then it talks about the presence of a hematuria. So practically a swimmer in a freshwater in endemic region is going to be having a development of hematuria, that means involvement of the urinary bladder. And on examination, what you find in this individual is that there is a very typical finding, eggs with terminal spine. Now that's a separate question also, guys. This is eggs with terminal spine which are going to be having an appearance like this, eggs with terminal spine. That's a standard image in the exam. What kind of schistosoma are we talking about over here? We are talking about a schistosoma that's given the name of schistosoma hematobium. In fact, I do hope that you are aware of the fact schistosoma hematobium is going to be having the presence of tobium, is going to be having the presence of a terminal spine that can be seen, which is going to be useful for identification over here. Why do we talk about this? If this infection is present for a long duration of time, the affected individual can be having the presence of a higher risk for development of urinary bladder cancer in the future. Another schistosoma which is asked in the exam may be having a history like this. Swimmer in the endemic region who's going to be having the presence of an initial itching. Now that is what is also called as cercarial dermatitis, but that is followed by the development of fever, chills, rigors, and there is a presence of diarrhea and abdominal pain. Far more importantly, a history of endemic region swimmer who is going to be having the presence of something like hepatosplenomegaly and portal hypertension, which means that on examination, you're going to be having the presence of eggs with lateral spine. So mark my words carefully, ध्यान से सुनिएगा बात को. Eggs with terminal spine was a feature of schistosoma hematobium. But जब आपको क्वेश्चन के अंदर आता है eggs with lateral spine, that means the eggs are going to be having an appearance like this. And आदमी से ज़्यादा टेढ़ा तो कोई होता ही नहीं है. So whenever you're going to be talking about schistosoma manzoni, schistosoma manzoni is an example of the organism that is going to be having the presence of a lateral spine. That's an important thing associated with portal hypertension. This is what is to be remembered over here, right? Having said that, we are then going to be talking about the important examples of the questions which can be given in the exam with respect to mycology or the fungal infections. Let's get started with the discussion with regards to a patient who is going to be immunocompromised. So he's going to be having the presence of HIV, and then this guy is going to be having the presence of a subacute fever. He's going to be having headache. He's going to be having vomiting. He's going to be having neck stiffness. All this is suggestive of meningitis, right? The CSF is going to be showing you the presence of high increased opening pressure, again suggestive of meningitis. And on the CSF examination, that's a buzzword, encapsulated yeast, which is going to be seen with the help of India ink only. Now, India ink staining is an example of associated with diagnosis of an encapsulated yeast. That is going to be an example of a negative staining. And of course, you know the fact in case of HIV positive individuals, one of the important causes or development of fungal meningitis is this particular infection that is given the name of cryptococcal meningitis. The causative organism over here happens to be Cryptococcus neoformans, which was already known to you. That's an example of a standard image that they put up in the exam. And please understand and mark my words over here. When you're using India ink, the background is the one which is going to be turning black. But the encapsulated yeast is the one which remains unstained and therefore it stands out prominently. This is what is going to be an example of a negative staining which is to be kept in mind. Then we are talking about an example of a patient who's going to be having a history of either asthma or this is going to be a patient suffering from cystic fibrosis. Now this guy comes to you because he's having the presence of recurrent wheezing. There is a presence of cough with brownish plugs. There is very high concentration of IgE antibody as well as eosinophil count happens to be high, and the patients are going to be having the presence of fleeting pulmonary infiltrate. In an asthmatic individual, in a patient who's going to be having cystic fibrosis, whenever we're going to be talking about wheezing in particular and fungal infection, you must think in terms of a fungus which is going to be having the presence of the acute angle hyphae. And may I just remind you of this particular fact, we are talking about something called as allergic bronchopulmonary aspergillosis, ABPA. Now, when we are talking about ABPA, this is what is going to be associated with ABPA, allergic bronchopulmonary aspergillosis. The causative fungus over here happens to be Aspergillus fumigatus. And when we are talking about this kind of an image, absolutely important image for FMGE exam, for NEET PG exam, for INICET, you're going to be having the presence of acute angle. Remember, A for Aspergillus, you're going to be having the presence of acute angle hyphae, which is going to be seen over here. That's an important feature of this particular fungus that is to be kept in mind. The next one talks about a patient who's going to be having the presence of a chronic lung cavity with hemoptysis, and this is what is going to be showing you the presence of a CT scan, shows you the presence of a fungal ball. Now, when the question is going to be making a mention of the word fungal ball within a lung cavity and the patient is having a presentation of cough with hemoptysis, you would be thinking in terms of what is going to be given the name of an aspergilloma. When I'm talking about aspergilloma, that's a paper 2 standard radiology question asked in the exam. This is the fungal ball that we are talking about over here. This is what is going to be suggestive of something like an aspergilloma. That is what is to be kept in mind. So if I am talking about allergic bronchopulmonary aspergillosis, आपने सोचना है वहाँ पे wheezing के बारे में, आपने eosinophilia देखना है, increase IgE antibody देखनी है, and there is a presence of pulmonary infiltrate. But when I'm talking about a lung cavity which is having the presence of a fungal ball like this, then you're going to be thinking in terms of aspergilloma. Again, there is going to be the colonization that is going to be taking place because of the Aspergillus species in these patients, right? The next one that we make a mention of is a patient who is going to be having a predisposing factor like maybe diabetes, or the patient is going to be having neutropenia. Now, neutropenia and diabetes are again conditions in which patients are going to be having higher risk of development of fungal infections, and these patients are going to be having the presence of acute sinusitis or facial pain. And a lot of you have seen those images from your COVID times as well. Patients are having the presence of a black necrotic eschar on the nasal turbinates. Very very dangerous with respect to this kind of an infection is ये वाली infection involve कर देती है brain के अंदर, that is because of the involvement of the cranial nerves. So when I'm thinking in terms of a black necrotic eschar and when I'm talking about a sinusitis and a facial pain, I would be thinking in terms of a patient who's going to be suffering from a condition called as mucormycosis. Now, when I'm talking about mucormycosis, of course, that's an example of a gross image which was given in the exam earlier, mucormycosis. That is a description that is going to be mentioned over here. And if I'm going to be looking at the picture over here with respect to the 90-degree angle of the hyphae that you have over here. So in case of Aspergillus, you are having the acute angle hyphae, but over here you're going to be having the presence of the right angle or the 90-degree hyphae. That is what is going to be seen over here. The next one talks about a patient who's again going to be a patient who is immunocompromised, AIDS patient, who is going to be having the presence of a progressive dyspnea. The patient is going to be having the presence of a non-productive cough. There is a presence of fever, and the classical history talks about a bilateral ground glass opacities. Very, very important hint with respect to the question that they put up in the exam. Bilateral ground glass opacities on chest X-ray in a patient suggestive of AIDS is very much suggestive of something like a pneumonia-like picture. And what's the commonest fungal infection to cause a pneumonia in these patients? Of course, you know the answer. We are talking about something that is given the name of pneumocystis cerevisiae pneumonia. That image is what I want you to constantly be in your mind. When you think about an HIV positive patient having a development of a fungal pneumonia infection, pneumocystis cerevisiae pneumonia. The importance of knowing about this kind of an infection is that for the prophylaxis and for the treatment, we are using the same antibiotic, which happens to be cotrimoxazole. Of course, you are intelligent enough to recall the fact cotrimoxazole is not one antibiotic. It's a combination of a drug like trimethoprim and sulfamethoxazole, and that is given, I repeat, that is given both for prevention as well as for treatment of a patient suspected to be suffering from pneumocystis erythroicae pneumonia. The next one talks about a patient who is going to be having a history coming from either of these states. Now, nothing derogatory against these states, but those are hints because some of these infections are much more commonly observed in the people coming from these states. For example, West Bengal, Khub bhalo achen, Uttar Pradesh, when we are talking about Bihar, and then we are talking about Assam. And what we are talking about over here in the patients are going to be having the presence of a exposure to either caving. So people go over there for the purpose of expedition or exploration of caves, and there is going to be a history of exposure to the bird or the bat droppings. As a result of which the patients are going to be having the development of pulmonary symptoms. This can include fever, this can include cough, this can include a feeling of dyspnea. And on top of it, patients can be having a far more spread out or disseminated disease because there is a presence of hepatosplenomegaly and there is a presence of pancytopenia. Now, what is that suggestive of? That is suggestive of something which I've shared with you earlier as well in the reels also. That's the Darling's disease, I believe, and most of you have an idea. This is what is going to be given the name of histoplasma capsulatum infection. So what we are dealing with over here is a histoplasma infection. That is what is to be kept in mind. Of course, we are going to be asked a question in the exam that is going to be based upon the appearance of the histoplasma, which is going to be an image again imprinted in your mind. So with a history of caving, with a history of bird dropping exposure, patient have pulmonary symptoms that is suggestive of histoplasma infection. This is what is to be remembered over here. The other name for this particular condition, Darling's disease, after the guy who discovered this. Of course, that is what you need to remember over here. The next one makes a mention of an individual who's going to be having exposure to Great Lakes or the Ohio River Valley, even though most of you may not have been to this place, but then that's a classical USMLE step 1 question and commonly taken extracted question from there only. So exposure to Great Lakes or the Ohio River Valley, and then the patients are going to be having the presence of a pulmonary infection, and the patients are going to be having the presence of skin and bone involvement as well. The big time hint in the exam by which you can crack this question is patients are going to be having the presence of broad-based budding yeast. BBB, broad-based budding yeast is what is going to be seen in these patients, and that is what is going to be reminding you of a wonderful character that you and me enjoyed in our childhood as well. That we're talking about something like a Mickey Mouse appearance. What we are talking about over here is the figure of 8 appearance as well, and that is what is going to be reminding you of blastomycosis. So blastomycosis, and that's how most of the people tend to talk about this. B means 8. Something that was very, very helpful with regards to Burkitt's lymphoma topic also that we talked about, and B with 8 is going to be having an appearance. So it can be a B like this. I mean a small b and then a big B. That is how we talk about this, right? And this is an appearance which is going to be of a budding yeast, which is very much suggestive of infection caused by blastomyces dermatitis, right? That's what you need to remember over here. The next one makes a mention of a patient who's going to be having exposure to dust in the deserts, and therefore the patient is going to be having the presence of a fever. There is going to be a presence of a joint pain or a flu-like illness. The patient doesn't feel too well. This is what is going to be given the name of desert rheumatism. So flu-like illness with erythema nodosum is going to be given the name of desert rheumatism, and specifically why that is important is because this infection can be responsible for causing meningitis. Remember my words, meningitis in a patient who is immunocompromised. When I'm talking about a patient who's going to be immunocompromised and who's going to be having this kind of a condition, in fact, the keyword over here is desert rheumatism. This is what is going to be remembered by you in the exam by the name of coccidioidomycosis. Of course, you know the answer when I'm talking about coccidioidomycosis. The causative fungus for this kind of a condition is Coccidioides immitis, and that is what is going to be associated with these terms. So aspergillus is one important one, blastomycosis is another one, histoplasmosis is another one, and coccidioidomycosis, the fourth example of an infection, pretty common in the exam. One out of these given as a history based question in the exam. The next one is very, very easy and very, very commonly observed in the clinics. So one of the commonest infections. ये तो आपको आना ही चाहिए. छोटे बच्चे के अंदर आपको देखने को मिला diaper rash. Or it can talk about an individual who's going to be having the presence of oral thrush. Oral thrush is in presence of a whitish plaque which typically can be removed. Why do I talk about this? When you're talking about a whitish plaque which cannot be removed in an individual, that is suggestive of leukoplakia. This is a whitish plaque which can be removed. Paper 2 में ध्यान रखिएगा, question अलग अलग हो जाते हैं. It can also talk about a female who is going to be, let us say, having diabetes, and this female is going to be having the presence of vulvovaginitis. Now, because she is having a fungal infection caused by the fungus, she is going to be having the presence of a thick whitish discharge after antibiotics. So, two situations, either she is a female who is a diabetic and therefore at high risk for development of Candida infection, or the patient has taken antibiotics because of which the normal natural flora is going to be replaced by the presence of the fungus becoming pathogenic over here, and that is what is going to be causing the vulvovaginitis. So what I'm talking about over here happens to be candida infection. Now with regards to candida, that's an example of a vulvovaginitis picture when they talk about the presence of this kind of a situation where the patients are going to be having the presence of a gross appearance or the presence of a candida infection over here. And the second one that they talk about over here is typically they show you the presence of a germ tube and there is a presence of a budding daughter cell. Very commonly asked image in the exam. So both these images pretty important from the perspective of the questions that they put up to you in the exam. The last one that we talk about over here is a situation where the patient is going to be having the presence of a pruritic or itchy scaly lesions which are having the presence of a central clearing. And especially when you're going to be talking about the KOH preparation, the potassium hydroxide preparation, they would be having the presence of a septate hyphae. The other important term that we are using for them happens to be ringworm, very commonly observed in your practice, and that can be causing involvement of either the scalp or there can be involvement of the body or there can be involvement of the limbs including the feet. So what we are talking about over here essentially is an example of a condition that is going to be given the name of dermatomyophytosis. Dermatophytosis, not myophytosis. Dermatophytosis now can be having three important subtypes as you are familiar. The first one that we talk about is what is going to be given the name of epidermophyton. Epidermophyton is what is going to be having the presence of, this is what is very important, the club-shaped appearance. Club-shaped appearance. What is an example of the tissue which is going to be affected by epidermophyton? Is it going to be skin, hair or nail? Of course you know about the fact epidermophyton is the one which is going to be causing involvement of skin and nail. The second one I talk about over here is microsporum. So when I'm talking about microsporum, this is going to be having an appearance which you are understanding over here, spindle shaped. Club shaped tha epidermophyton ka. Microsporum ka we are talking about the presence of an appearance that is an example of a spindle shape. That is what you need to remember over here. And microsporum is what is going to be causing involvement of skin and hair. Epidermophyton kiska tha? That was causing involvement of skin and nail. Whereas microsporum is going to be causing involvement of skin and hair. That is what you remember. When we are talking about the third one, this is what is going to be given the name of trichophyton. So tri means three. Therefore, easy for you to remember. It can cause involvement of skin as well as hair as well as nail. That is what is very important. And of course, you're going to be having the presence of this kind of a pencil shape over here. So trichophyton is going to be having the presence of a pencil shape. The microsporum is what is going to be having the presence of the spindle shape. Epidermophyton is what is going to be having the presence of a club shape. That is what is going to be seen as a feature of dermatophytosis. Those are the important ones that they typically love to ask you in the exam. So mark my words, with regards to the parasitology and the mycology images, those buzzwords as well as the example of those images are very helpful or handy for you to crack the questions in the exam. Make sure that you are watching this particular video prior to going in an exam, and I'm sure by watching all the three videos of microbiology as well as the other videos that we have made for you in the Train Your Brain series, you're going to be coming out in this particular subject with flying colors. As always, do take very good care of your health.